From your test, it turns out that you have developed pregnancy diabetes. This is a form of diabetes that only occurs during pregnancy. With pregnancy diabetes, there is temporarily too much sugar in your blood. This occurs in 1 in 20 pregnant women. Too much sugar can cause problems for the unborn baby. The baby could grow too big, and after the birth, the blood sugar can get too low or the baby can become jaundiced. When your blood sugars are well controlled, there's less chance of the baby having these problems. Firstly, you will be referred to a dietitian. They will discuss together with you what would be a healthy diet and how you can make adaptations to your own diet. Furthermore, it will be explained how to measure your own sugar levels and what the normal parameters are. Because of the increased risk of a bigger baby, you will receive extra scans during your pregnancy to check the growth of your baby and the amount of amniotic fluid. If the growth and the blood glucose levels stay normal, you can stay under the care of your own midwife. If your blood glucose levels stay too high, it might be necessary to use medication to keep your glucose levels normal. The medication is known as insulin and is prescribed by the specialist diabetes nurse or internist. You can pick the prescribed insulin up at your own pharmacy. When you start using insulin, you will be under the care of the hospital. If you use insulin, you will be induced at 38 weeks pregnancy in hospital. After the birth, the baby's blood glucose levels will be checked. If your blood glucose levels stay within normal levels and you do not need insulin, you can choose whether you would like to give birth in the hospital or at home. There are no further checks needed after the birth. After giving birth, pregnancy diabetes usually resolves itself. It is important, however, that 6 weeks after birth you check your blood glucose levels for 2 days, like you did during your pregnancy. This way, you will know for sure if the pregnancy diabetes is gone. There is no problem to breastfeed, even if you used insulin. Pregnancy diabetes occurs because of the pregnancy and is temporarily. It tends to go away after the pregnancy. We only know that your pregnancy diabetes is gone if you check your blood glucose levels for 2 more days 6 weeks after you give birth, just like you did during your pregnancy. There is a 60 to 75% chance you will also develop pregnancy diabetes in a subsequent pregnancy. Also, there is a 50% chance of diabetes at a later age. Therefore, we advise for you to have your glucose levels checked yearly by your GP. For more information, please see the information brochure Pregnancy Diabetes. Should you have any further questions, please contact your midwife or gynecologist.